So the respiratory system, right? So respiratory system, usually if we give a look, the system start from your nose up to the base of the lungs. So nose also communicated with some sinus, this area. Sinus basically lighter our bones, especially help to make the balance. There's so many air hole inside the sinus. Whatever they communicated and connected through the trachea, then larynx, pharynx is there. Trachea communicated. You see the bones look like the ring, and then trachea bifurcated, one to left, another to right. So here I said the right lungs has a three lobes, but the left side has a two lobes. And also, you know, this is the left side is the heart is there, and right side just below the lungs there are liver. Liver is there, heart is there. So this is the diaphragm. The diaphragm has two major functions. One, they are the main muscle for respiration. So when diaphragm go up and down, or contraction and relaxation help to lungs for inspiration and expiration. And also diaphragm divided thoracic cavity from abdominal cavity. So this is the partition between thoracic cavity and abdominal cavities. Now go here. So what is the normal function of respiratory system? They divided the function according to the primary function and secondary function, or other function of the respiratory system. The main function of respiratory system, definitely everybody know that, help in the inspiration and expiration. So during the respiratory cycle, they provide oxygen for metabolism in the tissue and remove carbon dioxide, the waste product in metabolism. So when we inhale, we take oxygen from the environment through the nose. This oxygen goes through in the lungs, where blood comes from heart, but that blood contains carbon dioxide. So in the lungs, in the capillary level, or in alveoli, where blood get a chance to exchange good and bad materials. So blood relieve the carbon dioxide and get oxygen, and this oxygen come from environment, in processing go to the lungs. So definitely the target of this oxygen go to the tissue level where metabolism occurs, especially in the liver. And during the metabolism, you know that energy produced, but the byproduct is a carbon dioxide. What are the waste materials? So this carbon dioxide again carry out by the red blood cell, and then they come inside the lungs, and again same procedure repeat and repeat. So this is the major or main function of the respiratory system. What are the other function of respiratory system? Other function of respiratory system are they facilitate the sense of smell. Yes, nose has a cell. The nose can identify what it is, right? Suppose you are sitting there, somebody cooked very tasty food and bring inside in front of you. So your nose can feel the taste, what it is. And your salivary glands start to secrete saliva, right? So produce the speech, they help to phonation. They help to phonation, produce speech, make it melodious. Also, lungs is most important for balance, acid-base balance, body water level, and also heat balance. So lungs play an important role acid and base balance because carbon dioxide is a acidic substance, right? They help to maintain the pH level and also some water balance. They help us some water balance and heat balance in the body. And here showing the picture here, you can see respiratory system start from nose. Then there are so many sinuses there. And then they communicate in the pharynx. This is the pharynx. And here also another gland is called tonsil. If inflammation of the tonsil is called tonsillitis. Pharynx then continue to the larynx. So this portion is a common pathway for respiratory and for gastrointestinal. So there are some orifices there. When you eat something, this orifice should be closed and food will not come to the respiratory system. So then after pharynx, larynx, inflammation of the pharynx is called pharyngitis. Inflammation of the larynx is called laryngitis. As I told you before, infection or inflammation, if occurs in the tonsil and causes tonsillitis or pharynx called pharyngitis, patient present with a sore throat. But the sore throat, if causes underlying pathogen or infection, this infection easily can attack your heart or easily attack to the kidney. So it is very important if anybody has a sore throat or pharyngitis, get an appropriate antibiotic, especially the baby children. So then the larynx is continued to the trachea, and trachea is divided into two. One is left, other is the right. In the left side, there are three lobes. And this trachea divided to the bronchi or bronchiole, bronchi and bronchioles. And the ending portion here is called the pleura. So the lungs is covered by a layer. This is the cover and this is the lungs. Between the cover and lungs has some space. It's called pleural space. Sometimes fluid is accumulate inside this space. It's called pleural effusion. And bronchi again divided to small branches. This is called bronchiole. If we go in this picture here, you see they divided the respiratory system through upper respiratory tract and lower respiratory tract. When if we use in this lecture upper respiratory tract means nasal cavity, pharynx, and larynx. If we use the lower respiratory tract, it means trachea, then trachea bifurcated is called bronchi, primary bronchi, and then they again divided to bronchiole, or the lower portion of the lungs, trachea, bronchi, and the lungs, the lower respiratory tract. So now go basic anatomy of the respiratory system. Basic anatomy, I said. So what are the structure of the lungs we discussed a few minutes ago? This is anatomy, and how lungs is work, how trachea work. This is physiology, function. When any pathogen infected like pharyngitis or laryngitis, this is pathology, right? If patient has a sore throat, you go to the doctor office, they gave you antibiotic, means pharmacology, respiratory pharmacology. So anatomy means structure, physiology means basic function, and pathology means disease process. And when anybody has a disease, give the treatment means pharmacology. So upper respiratory tract start by the nose, then continuation to the sinus. So sinus is a air-filled cavities. So these cavities contain the air and make our bones is lighter. If our bones is too heavy in the mouth or head, how we has to control or how we have to carry out these heavy bones? It is not heavy because of sinus. Sinus is the area where air is go and fill it up and make our bones is lighter. And also sinus help to phonation, melodious speech, and pharynx, the passageway for respiratory to digestive tract. So this is the pharynx. This is the common pathway for respiration and GI. When we eat something, the pharynx should be, valve should be open, close, and then no food goes to the respiratory system. And pharynx is divided into nasopharynx, oropharynx, laryngopharynx. So the portion of the pharynx, what is the just behind of the sinus or nose, called nasopharynx. The pharynx, what is the related to the oral cavity or behind of the oral cavity, oropharynx. And the part of the pharynx, what are the close to the larynx, is called the laryngopharynx. Here, so it is behind the nasal cavity, nasopharynx, in the oral cavity, oropharynx, and this is the larynx, the portion what is the close to the larynx, laryngopharynx. Now go for the larynx, the lowest lower part of the upper respiratory tract, larynx. So larynx is always two pairs, and it is called vocal cord. So or larynx contain the two pair of vocal cord, and vocal cord help to sound produce. If anybody is a smoker, they have a chance of develop the vocal cord carcinoma. If anybody is singer, right, they have a chance of develop vocal cord problem because they use it too much. The opening between the true vocal cord is the glottis, right? Glottis. So glottis play an important role in the coughing, and which is the most fundamental defense mechanism of the lungs. So, you know, when any food is entered to the respiratory system, we cough, means your body try to protect not to go food particles in the respiratory system. So coughing is a protective mechanism. So your body fighting, right? So now in this picture, here showing epiglottis. Yeah, so when we eat something, epiglottis close the respiratory system, and sometimes infection occur in the epiglottis, and this is called epiglottitis. So in the upper respiratory tract, one of the important organ is called epiglottis, right? This epiglottis prevent food enter into the tracheobronchial tree or respiratory system, and sometimes inflammation or bacteria get catch to the epiglottis and causes epiglottitis. So epiglottitis, another source of infection, can be transmit the infection from epiglottis to the kidney or heart. So if anybody has epiglottitis, it is very important to get appropriate antibiotics, right? So here we go, lower respiratory tract now, and we say the lower respiratory tract is consists of trachea, primary bronchi, and lungs. So the trachea located in front of esophagus, So a respiratory system is, if you talk about the from anterior to posterior, the respiratory tract is front, then gastrointestinal tract. So trachea located in front of esophagus, bronchi and branches into the right and left mainstream bronchi. So this is the trachea, and they bifurcated two branches, right? And mainstream bronchi, they said, begins it is called the carina. Right bronchi is slightly wider than the left, and maintain the bronchi divided into secondary or lower bronchi, what we explained a few minutes ago. And bronchi are lined with the cilia, ciliated. So when any infection or any dust material enter inside, the cilia try to catch up. Okay, so now go next here. So lower respiratory tract now. Here we are going to lower respiratory tract, and lower respiratory tract is, I say, the trachea bifurcated. They make the bronchi or bronchioles, and this bronchi and bronchiole again subdivided and enter inside the lobes, and inside the lobes there are so many sac look like this. It's called alveoli. In the alveoli, actually blood is exchanged with oxygen and carbon dioxide. Alveoli. If anybody has a COPD or bronchial asthma, their alveoli does not relax. They are constricted. If they does not relax or constrict, relaxation and contract, it is difficult for respiration. So if it is relaxed, it not rigid, not contraction and relaxation, difficult of respiration. And this is the medicine salbutamol we use to facilitate the lung alveoli relaxation and contraction. So this is the portion, the bronchiole, again, bronchi from the secondary bronchi subdivided into the small terminal and respiratory bronchioles. The bronchioles contain no cartilage, and terminal bronchiole contain no cilia also. Lung alveolar duct we are talking about here, and it is called alveoli. So alveoli, sometimes this is a gland called acinus gland, right? Contain inside the alveoli. Alveolar duct branches from respiratory bronchiole. And alveolar sac, so this is the alveolar duct here, and every one is called alveolar sac. So alveolar sac, which is arised from the duct, contain the cluster of alveoli, which are the basic unit of gas exchange. So if I ask you where actually gas exchange take place, you can say alveoli or alveolar sac, right? It is one point is very important. Alveolar sac contained one of the protein called surfactant. Surfactant help to keep the patency of alveolar sac. If patient has a deficiency of surfactant, that times alveolar sac get collapsed. It is some of the unfortunate baby has this problem. When baby inside the uterus, mother blood give them oxygen. Their lungs is not mature, but as early they come to the world, right? That after delivery, if the baby has enough surfactant, their lungs easily can work. If anybody has the absence of surfactant inside the lungs, they have a problem of respiration. Surfactant. So surfactant a phospholipid protein. So surfactant is a protein but mixed with phosphorus and lipid that reduce the surface tension in the alveoli. Without surfactant, the alveoli would be collapsed. What next? And here in this picture, basically showing, you see, this is the trachea then bifurcated, right and left bronchiole, and then they again subdivided to every lobe. This is the upper lobe, middle lobe, lower lobes. So they bifurcated for lobes here, and finally these bronchioles end with the alveoli. And here is showing the pleura. Outer layer of the lungs is called pleura, and this is the diaphragm, the main major muscle for respiration. They're showing the ribs. So the trachea bifurcated right and left bronchi. Then again they divided to the every lobe, and this is called bronchiole. Bronchiole end to the alveoli. The lungs is a layer is called pleura. Sometimes fluid is accumulate in between lung central cavity. It is called pleural effusion. When you put the stethoscope or when you do the percussion, we will understand it is normal or abnormal. So if we go here, the anatomy of the anatomy and physiology. So they said the lower respiratory tract. Now going to lower respiratory tract anatomy and physiology. So here you see the lungs, the lower respiratory. Okay, in this picture showing right and left lung. And as I told, right side has 3 lobes, but left side has 2 lobes, superior lobes, inferior lobes. But the right side, superior, middle, and inferior. And this is the area for heart, and this is called mediasternum. So this area, if anybody has a lung cancer, and if it is diagnosed very early level, we has to remove entire lobe, like cancer on the lower inferior lobe of the left lung. We have to surgically remove these lungs, and patient is okay without one lobe. The problem if the cancer is spread over, it is difficult then, right? So now go for the basic talk about the lungs. So they said the lungs located in the pleural cavity. Pleura is the lining of the lungs, extended from just above the clavicle. So in the one of the bones on the top here is called clavicle. In the clavicle or close to the clavicle, this is called the apex of the lungs, and this is called base of the lungs, just upon the diaphragm. So right lung, which is larger, little bit larger than the left lungs, and divided into 3 lobes: upper, middle, and lower lobes. But on the left side contain the 2 lobes, and they are a little bit narrower than the right lungs and accumulate 2 lobes, superior and inferior. The respiratory structure are innervated, means nerve supply, innervated by phrenic nerves. Phrenic nerves supply to the lungs, and also the vagus nerve, and thoracic nerves. So phrenic, other term of the lungs. So lungs is supplied by the phrenic nerves. 10th cranial nerves is called vagus supply also, and also thoracic nerves. The parietal pleura line inside the thoracic cavity. So the pleura has 2 layers. 2 layers. One is called parietal pleura, another is called visceral pleura. 2 layers. The thin fluid layer, which is produced by the cell lining of the pleura and lubricant the visceral pleura and the parietal pleura, allowing them to guide the smoothly and painlessly during respiration. And blood flow through the lungs by pulmonary circulation. And here we go next. The respiratory muscle. So respiratory muscle basically help us in the respiration. In this picture showing the muscle of respiration. So there are 3 muscles in the top. This is called sternomastoid, and also scalene or scale. So sternomastoid or sternomastoid, one of the important muscle for respiration, and also some of the muscle in between 2 ribs. This is the ribs, right? So muscle in between the ribs, it is called inspiratory intercostal muscle. Intercostal. Costal means ribs. And some of them internal and some of the external. or is called inspiratory intercostal, and this muscle is called expiratory intercostal. Means this muscle help during inspiration, and this muscle can help during expiration. So it is called expiratory intercostal muscle. This inspiratory intercostal or expiratory intercostal muscle, it is only defined to the direction of their fiber, and also their function is a little bit different. And another muscle called external oblique muscle, and this is the diaphragm, the major muscle of the respiration. So accessory muscle of inspiration, accessory muscle of the, so major muscle is the diaphragm, other muscle directly or indirectly help to the respiration. This is called accessories muscle. Accessories muscle. Accessories muscle include the scalene, then also sternocleidomastoid, right? The accessories muscle. The respiratory process, the diaphragm descend into the abdomen and causes negative pressure inside the lungs. Negative pressure is always the air from the area of atmosphere into area of the lower pressure. If the lungs air passing through the terminal branch oxygen that blood and oxygenated blood tissues. At the end of inspiration, the diaphragm and intercostal muscles get relaxed and the lungs get coiled. So the basic theory of respiratory process, we need to develop negative pressure. So because of negative pressure, the respiratory system can get started to work. And here showing the lower respiratory tract, the process of respiration, right? The process of respiration, the lowest respiratory tract, they said, the lungs recoil again, pressure within the lungs become greater than atmospheric pressure and causing the air, which now contain the cellular waste product of carbon dioxide and water, and to move from alveolar lungs to the atmosphere. An effect gas exchange depends on distribution of gas, right? So ventilation and perfusion. So NCLEX board sometimes asks the mechanism of respiration, what kind of pressure we need? Negative pressure. We need the negative pressure. Okay, so now going to talk about the diagnostic test. So in this picture, you can see the radiography of the chest. Radiography means X-ray. If you take a X-ray or radiography, anterior posterior view or posterior anterior view, basically we're supposed to see the blackening this area because of ER. If any tumor or mass, we can see whitish. So what they said, the diagnostic test in case of respiratory system, the most common one is called chest X-ray. Chest X-ray. So provide the information regarding the anatomic location and appearance of the lungs. So if you take a chest X-ray, we can see the anatomy of the lungs. Okay, anatomy of the lungs. Also, we are able to see any kind of pathology if there. What you has to tell pre-procedure, before the technique, if definitely you has to explain to the patient what will do, right? You has to explain, you has to take their consent, right? So also we has to remove all kind of jewelries. We has to make sure patient do not have any kind of pacemaker there. So remove all jewelry, other materials object from the chest area, and determine the client ability to inhale and hold. So when we took the picture, tell the patient to hold the breathing. After procedure, help the client get dressed up and return back his jewelries or her jewelries. Question: women regarding the pregnancy or possibility of pregnancy before the perform. So when if in case of female childbearing age, you has to ask they are pregnant or not, or chance of pregnancy within month, right? If anybody has this positive history, we tell them not to do this. Okay, so this radiology is not good for the baby. So now continuation of the other diagnostic test. This is called sputum collection. So like I give a scenario, if a patient has a TB or tuberculosis, we has to, then we know that TB can help to diagnose by tuberculin test, but confirmatory test, we has to examine the sputum. If the acid fast bacilli present there, identification. Also, it indicate if acid base AFB, acid fast bacilli positive, patient first TB, right? So, or other things is sometimes there are so many infection, we has to collect the sputum. So how have to collect the sputum? Specimen obtained by expectoration or tracheal suctioning to assist in the identification of organism or abnormal cell. Identification of organism, right? So sputum collection. If patient has an infection, if patient has an infection, so we have to collect the sputum and culture it to find out what organism it is. But if you start the antibiotic once, you will not get this one anymore. So if you need to collect the sputum for identification of the organism, make sure your patient will not take the antibiotic yet. If patient start the antibiotic, you will not get anything organism inside the sputum. So now preoperative, determine the specific purpose of the specimen collection, and definitely check with the institutional policy. So we have to talk to the patient what we are going to do, take their permission, follow the guideline, police institution policy guideline, and also national guidelines. And it is better if you collect the sputum at the early morning. And also keep in mind, you have to collect the sputum deep throat, tracheal secretion. Obtain an early morning sterile specimen by suctioning or expectorating after a respiratory treatment, if the treatment is prescribed. Early morning, sterile specimen, very important. So instruct the client to raise the mouth with a water before collect the specimen. And again, one thing here, instruct the client to take the severely deep breath and then cough deep to obtain the specimen. Always collect the specimen before the client begin antibiotic. NCLEX ask this question.
Excuse
Okay.
me, Dr. B.
Yes.
In this case, if you have to collect it early in the morning, you can suction the patient first. You do the suctioning first.
And usually we do not need to suctioning first if patient are stable. But if patient is very bad, a lot of secretion, right? We just collect the specimen from the secretion. From the secretion. We
Dr. B.
So always collect the specimen before the client begin antibiotic. So if we start the antibiotic, the sputum will not show any kind of organism or pathogen. Now go here, the bronchoscopy or laryngoscopy. Before to go broncho or laryngoscopy, what we have to tell the patient after procedure of sputum collection. If the culture of sputum is prescribed, transport the specimen to the laboratory as early possible, immediately. And definitely we have to help the patient for mouth care, educate the patient for the mouth care. Ensure the informed consent has been obtained for any procedure that is invasive, because we handling with the patient, we put something in the throat. This is the invasive procedure. Vital sign measurement is important, right? If any abnormal vital sign means fluctuate, patient is not stable. Now go for another test. It's called laryngoscope or bronchoscope. So laryngoscope or bronchoscope, basically this is small camera. We put it to the upper respiratory tract and taken some picture, or we can see in the videos, right? So direct visual examination of larynx or trachea or bronchi with a fiber optic bronchoscopy. So we can see, is there, if any excess secretion, any kind of congestion, any inflammatory change, or any obstruction. Basically, by laryngoscope or bronchoscope, we see any patency of the airway. So in this picture showing the laryngoscope and patient position, right? Little bit up the chin, head is support. So pre-procedure, what we has to tell to the patient, we tell not to take any food, means nothing by mouth status, and collect the result of any of coagulation studies. Remove if patient has any extra denture or eyeglasses, we have to remove them. Ensure the client has intravenous access. So we have to make sure everything there. If any complications start, we have to manage the patient and have an emergency resuscitation equipment so put to be there. So emergency equipment like CPR, like suctioning, oxygen, everything supposed to be there. If any kind of complications start, then you should be prepared for management. And now go here, this is very important for NCLEX board. Laryngoscope and bronchoscope, post-procedure. Patient positioning, semi-polar. semipolar. Any kind of respiratory problem, always semipolar or highpolar posturing. Patient is nothing by mouth before the procedure. After the procedure, you has to tell them, or you should check the gag reflex. If gag reflex is returned, you could allow them to eat to food, but always liquid food first. Liquid first, then go solid food. But make sure gag reflex is there. And also monitor for blood sputum. Monitor for respiratory status, particularly if sedation is given. Because this is an invasive procedure, we give them mild sedative. Monitor for any kind of complication after procedure, such as bronchospasm or bronchial perforation. You are using the needle there, so chance of perforation, bleeding, and especially cough with blood, or bronchospasm, constriction, patient has shortness of breath, indicated by facial or neck crepitus. So if you put the stethoscope, you can find the extra added sound, crepitus, or dysarrhythmia, hemorrhage sign, hypoxia, oxygen-less cyanotic, or lungs full of air called pneumothorax. Notify the healthcare provider if we see any kind of sign and symptom like this. And here showing another two test. One is called pulmonary angiogram. This is the pulmonary angiogram. You put something in the pulmonary system and can see any kind of obstruction or problem in pulmonary artery or vein. This is called pulmonary angiograph. Another test is here. This is called endobronchial ultrasound. Endobronchial ultrasound. This is the one camera passing by and take the picture, and you can see directly visual. So tissue samples are obtained from central lung masses and lymph node used to bronchoscope with the help of ultrasound guided. So ultrasound guided procedure. So in this procedure, we not only take the picture, sometimes we collect the tissues. Tissue samples are collected for use for diagnosing or staging the lung cancer. So staging the lung cancer to detect any kind of infection or identification inflammatory disease that affect the lungs, such as sarcoidosis. Post-procedure, the client monitored the sign of any kind of complication like bleeding or shortness of breath. Now go for pulmonary angiography. It is a fluoroscopic procedure in which the catheter is inserted. Catheter is inserted through the antecubital or femoral vein into the pulmonary artery. So in this picture showing, this is the antecubital or femoral artery. So dye is a special type of substance is passing by through the artery, enter inside the pulmonary system. And because of this dye, when we take the picture, it is more visible. Like this is showing in this picture, dye is passing and all of the branches, arteries, veins, tributaries are visible. If any kind of obstruction is there, we can find out. If any kind of extra mass or tumor is there in the arterial system, we can see, right? So pulmonary angiogram is an invasive procedure. We use some substance, right? So always we have to make sure patient has any kind of allergic reaction to the radio opaque substance or not. So involve an injection or iodine or radio opaque or contrast media. So till we have to know patient do not have any allergic reaction to the iodine or contrast media. Their kidney function is normal. If the kidney is not normal, then contrast media is not good. And post procedure, make sure patient take enough food, enough water. When more water, more peace. So water, I mean, dye or contrast media has to passing out through the urine. So in this picture showing pulmonary angiography, by the pulmonary angiography, we can see the vascular system inside the lungs. And here showing the scan or CT scan. CT scan viewing very visual substructure, right? So here showing pulmonary angiogram pre-procedure and after procedure. What we have to educate the patient. Check the allergy to the iodine or seafood or other radio opaque dye. So if the patient has a history of this, they are not a good candidate for pulmonary angiography. So as a RN, it is your responsibility to find out any kind of allergic reaction or not. Maintaining the nothing by mouth status for the client as prescribed. Check the result of coagulation studies and ensure intravenous access is established, and also assist to administer sedation as prescribed. Reinforce the instruct about the need to lie still during the procedure. Tell the client that he or she may feel an urge of cough, nausea, or salty taste. So before the procedure, if you tell them, so they should be aware about that. They will not be panic or not will stress. So you has to know how to control and not to be stressed. So be energy also have the emergency resuscitation equipment there. Oxygen should be there. Suctioning machine should be there. If any complications start, we should manage them. So now go for post-procedure. So post-procedure, what should do? Avoid taking blood pressure for 24 hours in the extremity used for the injection. So if use the dye femoral artery or cubital artery, we will not take the blood pressure next 24 hours. Also monitor for the peripheral renovascular status. We have to check the pulse, we have to check the blood supply, or we have to check the sensation. Renovascular status we check. If any kind of blocking because of dye, we can find it out. And check insertion site for bleeding. If femoral artery or antecubital, check any kind of phlebitis or any kind of inflammation or bleeding is there or not. And also monitor for delay reaction to the dye, because some patient the reaction start later on. So here we have to check after a few minutes for any kind of complication if arise.